Hi there, this is Ash from Gojji. I'm the Managing Director and Clinical Pharmacist, and today I want to tell you about Gojji's multifunctional meter and services that could greatly impact your community health center. So let's get started. Pop quiz. Recognize any of these particular glucometers that you're currently providing to your patients? How do your patients like these? Are you getting any data? If they're at home, are you able to know how they're doing? Just imagine if all your Medi-Cal patients used a quality meter where you got readings automatically and knew at all times how they were doing. The dream is true. Let me give you two case studies. And what I want to exemplify here are two common behaviors you will see with diabetes patients. Here is a first one where a patient was very controlled. All of a sudden was very hyperglycemic, up in the 600-700 range. Our remote monitoring was able to pick that up and quickly were able to bring it down. But on the flip, you'll see a lot of patients that are actually very low in their blood sugar, hypoglycemic, and they don't even know because they don't even understand which symptoms they're actually experiencing. Again, our program is able to pick that up and get them into range quickly to avoid any particular acute activities. So let me introduce. I have the cool job of telling you about a simple, risk-free, guaranteed no-cost solution that improves outcomes for Medi-Cal patients. Gojji was designed on a principle, and the principle of knowing when a patient needs intervention, which patient, and at what time. Those principles have allowed us to design a program that has allowed patients to get better and also move your community health center's quality rates. So how do we do that? We predicate that on three main principles. The first principle is the quality of the product. Our product has a cellular chip that allows for data to be transcribed. We have remote monitoring services. In addition, we have wraparound services from both dietitians, coaches, and pharmacists. So collectively, our Gojji program allows you to jumpstart your quality initiatives and to get your patients to a much healthier state. Gojji is very easy. All you have to do is a 1, 2, 3. Send a prescription like you do for the current glucometer or even like you do for drugs. On the left, your patients will get the Gojji multifunctional meter, and I'll get to those features very soon. Or they'll be able to get on the right the blood pressure monitor for hypertension. After that, we onboard them, Gojji monitors them, and then we will just connect with the health center when there is a need for an acute issue or a follow-up needed. Let me dive now into why Gojji's multifunctional meter is very unique and one of a kind on the Medi-Cal formulary. So at the top left, you're going to see a cellular signal. That is because once patients test, immediately it connects to one of the cellular networks, just like your cell phone, and the data is sent real time. What's cool about this is that it actually does more than just glucose. It does ketones and it also does cholesterol. On the Medi-Cal formulary, only the ketone and the glucose test strips are covered. What is also unique is that when a patient tests, those readings are uploaded and we understand how that particular reading or a series of readings, and we will send them customized messaging to do something particular, like in a case of hypoglycemia, or if they have a continuous trend of hyper, we will kind of tell them what to do before a dietitian or a coach or a pharmacist reaches out to them to intervene. One of the things that health centers have actually liked a lot is that our meter is bilingual. It also is in audio and in text in Spanish, which is very key in getting Spanish speakers to better understand where they're at in their disease management. Our blood pressure monitor is definitely one of a kind. It is AMA validated, so it has gone through the vigorous testing and it has been proven to be very accurate, at the top of the best in class with the other ones. Only thing about this particular monitor is that it is Bluetooth enabled. Just have to quickly pair it and that data will come through. Most importantly is not only are you going to get the data from the glucometer for the diabetes, but you're also going to get the BP readings from our blood pressure monitor. So you get a 2-in-1 data transmission to better manage their chronic conditions. Let me dive into our platform and data. One thing you'll learn about Gojji is that we are very data driven. What I have here are two particular views of what you will see in terms of getting access to our Gojji portal, and I'll talk about that in a minute, but also our clinicians on site see the same views. The top left, you just have a great idea of when they're high and low. You even know if it's before or after a meal. And also you have a time study in terms of understanding what particular day, also what time of the day. This will help you narrow in. And this is the X factor, understanding when a patient is not doing well and what particular patient-specific intervention you want to conduct. As I mentioned, being data-driven, we want to make sure we stay connected with the health center and the patients. And one way of doing it on top of active real-time monitoring is reviewing the data. We provide you a population health quality scorecard, but also we're able to give it to you at a patient level. So you'll see we have both a diabetes and a hypertension scorecard. Here you'll see on the right side is where you'll know which patients. So our internal clinical team reviews this weekly. Also, we do challenge the health centers to also look at this to help bring them patients in to better provide coordinated care. Health centers will definitely get access to our Gojji Smart Care cloud-based provider health portal. You'll be able to see the readings real time. You'll get some insight and analytics and quick graphs to quickly tell you how the patients are doing. No cost guarantee to the provider as part of our Gojji guarantee. A lot of CHCs ask about, can you EMR integrate? Simply, yeah, we can. We are actually already integratable already, and we actually are actively integrating with different EMR systems. Here you just get a glimpse of how long it takes. More importantly is we want to provide this as part of our guarantee of no cost to the CHCs for no cost. We ask for X amount of patients. We are very transparent about how we want economies of scale, but there's only cost that the CHC would absorb is the cost that may be part of their contract with the EHR. Other than that, all connections that lead up to your EMR systems, Gojji will be able to cover that cost with that minimum Gojji population. So let's get into how we're doing. So 2022 was a great year for Gojji, our first year implementing this program. We already have almost 25,000 patients, and you could already see, knowing how many patients we have, millions of readings. And in this space, this is very powerful in order to do very good clinical activity. 7 out of 10 of our patients actually tested. But one thing I really want to show you is 1 out of 4 of our patients actually alerted. Did you know that? That is pretty powerful in a way of understanding that patients don't even know that they may be high or low. So this is a good indicator of how real-time management is able to move that curve. And you'll be able to see within 6 months, we had a 10 basis point increase. And over the 2022, we're able to sustain that. So I am hoping that I could provide your community health center with the next level Gojji solution to provide these same outcomes to your patients. I love this graph. This graph clearly shows you how our patients are able to quickly improve their blood glucose, but more importantly, sustain it to continue to live a healthier life. You'll notice here that we're only at 70%. We're not happy with that. We are committed in 2023 and have plans in place to get to 80%. And we hope your CHC patients are part of that journey. So how do you get started? You may have recalled early on I said it was very, very, and very easy. And we mean that. All you have to do is send us a referral, and we'll do the rest. We'll call them to enroll them. We will then call them to follow up to make sure they had no onboarding issues and how they're doing with testing. We will then mail out any of their refills as part of their testing and make sure they're testing to what you prescribed. As they send in as the readings come in, we will then monitor them, and any acute issues or any follow-up needed, we will make sure that we contact your provider and community health center to bring them back in for further follow-up. I just wanted to quickly share a few reasons why CHCs are using Gojji, and these are things that they have shared as best practices. So it's helped decrease their operational burden. They're not having to call for readings. They're not wondering what the readings are when the patient comes in because they didn't bring their log or they didn't bring their glucometer. They're able to quickly go in and address what the care gaps are and quickly move that needle. Therefore, they're able to increase their quality outcomes. So they're seeing a great movement in their control rate and patients actually enjoying using the meter and wanting to test to control their particular chronic conditions. Understanding where the patients are is key because they know which patients they want to bring in. And more importantly, they're helping to decrease that show rate. So therefore, they are finding different ways to maximize their revenue, but more importantly, they're decreasing their costs. Because as I mentioned a few times, this is a no-cost solution for you. So no grants, nothing like that will be needed. So as I mentioned, in our guarantee, our Gojji guarantee of zero cost, no hidden costs, no contracts, nothing like that. All Medi-Cal patients, if they're on the blue and white card or they're part of a HMO managed care plan, are covered to get the Gojji supplies and services that your patients greatly need in order to better manage their diabetes. I hope you enjoyed what Gojji could present. I look forward to talking to your health center and enrolling your patients today. Thank you for your time.